Our next guest says the Obamacare health law destroys Medicare as we know it, and the only thing left standing is going to be the membership card. Here now to divulge major secrets even seniors don't know about, Betsy McCaughey, former Lieutenant Governor of New York, author of Decoding the Obama Health Law, What You Need to Know. First one up, okay? Doctors. What is going to happen here?
That's right. Doctors will be paid less to care for a senior than they're paid to care for patients on Medicaid, the program for the poor. And they'll be paid only about a third as much as they would earn taking care of a patient who has private insurance. And Larry, even the doctors who stay with Medicare and keep seeing patients aren't going to want to spend time on things like hip replacements when the pay is so low. But here's the hitch. They can't even agree to give you the care you need and charge you an extra fee for it. That's against the law. So you're trapped.
I want to come to the wheres and why for us, but let's go through. You've got two other major points.
That's
let's
right.
cover that first.
Hospitals are going to be forced to treat patients according to a very skimpy standard. Hospitals that spend more treating the elderly than the lowest cost hospitals spend, right, will be penalized. This was tried in 1997, and it pushed up the death rate for heart attack patients by about 8%.
Run this by me again. In other words, this is lowest common denominator spending
That's
for
right.
all hospitals.
Lowest.
Even if it's a high-end hospital that's supposed to have high-end services.
Yes, and we've also seen the data from California that elderly patients treated at these skimpy, low-spending hospitals have much higher death rates from pneumonia, hip fractures, congestive heart failure, whereas other patients treated in higher-spending hospitals for the same ailment recover and go home.
All right, let's go to your third point.
Right. And this is the next one. Seniors could lose their access to preventative services like getting a mammogram or colonoscopy. Section 4105 of this law empowers the Secretary of Health and Human Services to eliminate, that's the word in the law, eliminate preventive services for seniors based on the recommendations of the U.S. Preventative Services Task Force.
Is this unelected board, IPAB,
no,
or is
it's
this
a different one,
board?
but this one caused outrage last year when they said women over 74 shouldn't get routine mammograms. And by the way, the agenda is clear because half a page later, the same law empowers the Secretary to expand these services for people on Medicaid. All
right, this is extremely punitive, and it's going to really damage the quality of Medicare services.
It's going to shorten lives for many seniors.
Is this related to the $716 billion raid on Medicare?
Exactly. This is how it happens. It's not just the number, it's how they do it. They force hospitals, doctors, hospice care, home care, dialysis centers to accept such low payments to care for seniors that seniors aren't going to be able to find a place to get care.
So it's just a big raid on Medicare.
It's robbing grandma to expand entitlements for people under age 65.
As this stuff gets out, it's going to cause an uproar.
It should cause an uproar. It's immoral. And deadly dangerous.
Betsy McCaughey, thank you very much. We appreciate that update. That is some story. Coming up, Republican Senator